Senator Edward Markey, a Democrat of Massachusetts, who's joining this conversation with all of us this morning about the opioid epidemic in the country. And Senator, what's it like in your state?
Well, our state is in an epidemic right now. Last year in Massachusetts, 2,000 people died from an opioid overdose. Of those, 76% had fentanyl in their system. So replacing heroin, replacing prescription drugs like OxyContin is now fentanyl as the principal reason why people are overdosing. If people were dying at the same rate across the whole country as they are dying in Massachusetts, that would be 100,000 people who would have died in our country last year. And over 10 years, that would be 1 million people dying from opioid overdoses. That is an epidemic of unbelievable proportions. What is happening now is really a historic debate over the level of support which the American government is going to give to these families in order to provide the treatment which they need in order to deal with this problem.
And Senator, how is the state of Massachusetts dealing with the fentanyl situation?
Massachusetts has increased the amount of treatment. It has tried to put in place physician training and reduction in prescription of traditional OxyContin or Percocet prescriptions that can go to individuals. But fentanyl is coming in from Mexico through Canada into Massachusetts, into New Hampshire, into other states, now more than in other parts of the country into New England. But it's going to spread across the country inevitably, inexorably. And so the state of Massachusetts needs help. It needs more federal funding. It needs more treatment. And this whole debate that we're having about the Affordable Care Act, which will provide $90 billion in opioid treatment over the next 10 years, is critical because the Republicans are planning on putting in just a small fraction of that into their legislation that will pass, and that will be a catastrophe leading to the deaths of tens of thousands or hundreds of thousands of Americans who will not receive the treatment which they need.
We heard from a governor from your neighboring state, or New England area, New Hampshire, Governor Sununu, who said it's Medicaid expansion, the Affordable Care Act is not the answer, that governors like himself, they need flexibility, that the federal government should provide money, but then give the governors the flexibility to come up with their own plans.
What the plan is here in Washington that the Republicans are putting together is to take Medicaid funding, cut it, then put it into a block grant and send it back to the states. So it's really not, and they call it per capita allocation of funding. What it really is a decapitation of funding. You cannot have a solution to the problem that actually has a dramatic cut in the funding. That's what the Republicans are talking about. So a vision without funding is an hallucination. And that's really what the Republican plan is across this country. And it will actually worsen this opioid crisis because there will not be the help there for families at the local level.
Senator, what do you think was the source of this opioid epidemic in the state of Massachusetts? What caused this to happen?
Well, Massachusetts historically had a higher level of heroin problems than other states. And on top of that, beginning in 1996, after the FDA authorized the sale of OxyContin, the problem continued to rise. And now, because we're right on the track which the Mexican gangs use to send fentanyl into our country, we are now afflicted at a higher rate than other parts of the country. And so it's just problem piled upon problem, piled upon problem, which is why Massachusetts has a death rate 3 times the rate of the rest of the country. And so we know what has to happen. We know that incarcerating 2 million African Americans in the 1990s during the crack cocaine epidemic was a mistake. We owe an apology to that entire generation of African American young men. We know the answer is treatment. We have to get it to them. It costs money. If we do so, we can put in place the kinds of protections which can limit the harm, which is visiting hundreds of thousands of families, millions of families across this country as we speak.
Senator, let me ask you 3 questions that a viewer asked when he called in. Who is manufacturing these opioids? Are they promoting them? Are they using marketing to do so? And why not make them match dollar for dollar the expense of this opioid abuse problem?
Good question. Again, the problem began with Purdue Pharma receiving approval in 1996 of the sale of OxyContin as something which actually would not be addictive to the patient. So it was a false premise. The FDA accepted it. There's unfortunately a complicity there between the government and this private sector company, pharma, and then this epidemic just began. And so now we have it almost as something that people accept as normal, where drugs which are addictive, these opioids, are sold, are prescribed without any real full appreciation for the consequences, how quickly people can become addicted, and then that led to heroin, and then now it is leading to fentanyl as the drug which is killing individuals across this country. On my belief, we have to find some formula, yes, where these pharmaceutical companies who manufacture these drugs become more accountable for what they've done. This is creating a medical problem of historic magnitude, and we need funding sources that are going to ensure that these families get the help which they need.
Senator Edward Markey, Democrat of Massachusetts. Senator, we thank you for being part of this conversation with our viewers this morning.
Thank you. You're welcome.